So yeah, so today I will do my 36th flight in 6 weeks. So it's been a hectic autumn, I could say. Yeah. So today I will do a few things. I will go through first this a few templates. I will go through template presentations. That is important for you to have seen. It's a way you can start to think about future projects, companies. And then go through quickly how the business plan, and I will show you an example from one of my companies of a business plan. And then a short presentation about how to pitch. I will try to search and see if I have one of my old pitches as well. That's a real life example of a pitch. But first, one thing that is modern today, that is a good way of thinking when you start a company or from research to go to next, is to even manufacture a minimum viable product, what's called an MVP. So this was not the case 15 years ago when I started with startups, but now it's very common that they ask for that, and that the first milestone that you work towards is an MVP. Before the minimum viable product is ready to be tested, it could be, if it's an implant, maybe this will be the first product concept that you go into preclinically to animals with. It's very difficult to go into animals with the final everything is done. Remember I described yesterday, you have a frozen design and that's what you document. That's true, but you need to have data before that. And also, if you remember, it was 1 or 2 or 3 years before you had the frozen design. During that period of time, you develop one of these and you test. There could be a minimum, there could be a few. And so it's to determine the problems the product should solve for customers, translate the MVP functionality into a plan of action, and ensure the product aligns with the organization's objectives. So it becomes, you see, immediately becomes very complex. So you have the product and you also have a startup. We're talking about you guys starting a company. So you will have a startup, you will have investors. All of this needs to align in some magic way. So if this takes too long time, you will not get the funding. If it's too, you need to be able to, and with the MVP, that doesn't need to be the final product, but it's a huge difference if you're talking to investors or also for your self-courage or self-motivation. If you have a product, you can say, this is the product. It's not the one that is the final, but it's something you can hold. That's one of the good things with 3D printing today. You can print it, so you at least could have it on the table. Maybe it's not the correct one, but it's still something that you can show. So this is a template that could be used. For us now, it's more the way of us to think. When you can write down a minimum, write characteristics of unsuccessful products no one wants to use, and write characteristics of the most viable product on the market. And where they intersect, there you have the MVP. So this is the minimum and this is the viable. And then list the attributes of your MVP. So this is an exercise. It doesn't need to be. You can do that quite quickly in a product and very early on. So this is the minimum viable product. This is what we're going to do, and it helps you a lot. It creates a lot of value. This MVP. So in our products, my latest startup, what I call the therapeutics. This is exactly so. Yesterday I had a long meeting. Yesterday evening I had a long meeting with the team in Sweden. We're exactly around this. That I'm forcing them. They need to produce the MVP rapidly because we need to show that to doctors, show the handling. We can start to do some testing of it. We need to develop some quality measurements for the future manufacturing. So suddenly, if we have this MVP, it's not the real product yet because we still need to do some development, but they are now rapidly doing that one, so we can show it, and then we buy all the accessories that will be needed for surgery in the future. So I'm pushing them, so within the next 3 weeks, I would like to have the MVP. I could put it on the table, and I can show everyone what it's going to be, and I can give some numbers and values, and we can even go to animals with it. But also saying that this is just the first test, but it's the MVP for a medical device. So this is something for you to just remember, and when you start, do this exercise. Seems that it has to script. Anyway, a business model canvas is also an exercise you can do early on when you sit down with your research project and amongst the team here that might say, now should we go for it? Okay, you need to do a first plan, something that you put on paper that is not research. And this will pose you to ask a few questions. First, you've maybe had this MVP that you can do even in a research project. It even helps you when you present academic research. This is the minimum what we're working towards, because it helps you to present in your pitching. So a business model canvas is a template, is that for develop a new business model or clarifying the elements needed for an existing business model. It's a canvas or a chart that describes the firm's value proposition, infrastructure, partnerships, customers, finance, and then you will see it describes a lot. So we try to use this type of templates early on. I use it even for myself when I start for therapeutics, or if I have an idea, I can sit down even with myself, or now I might use my oldest kids are now into this thinking, so I use them a lot as well to bounce ideas with. So it looks like this. Could it be something with the screen? I think it's outside. Yeah, the ratio, if you can focus. So here it seems to be okay. On the screen, I think it's okay. So is it maybe, if it's the beamer, it's...
It's not refitting, but it's going outside.
Where is it?
Going
No.
out of the seat on the section.
Oh.
Yeah. This one.
Okay.
That's the final.
That-
Cross one, that cross one. There's no cross one.
Okay.
That's the minimum.
That's minimum.
Maybe can show this without this section. This one is
Should I write this?
yeah. Hopefully it is okay for you.
Yeah. Okay.
If you are comfortable.
No, I'm fine. Okay, so a business model canvas. It's actually it could just take a couple of hours to start with. Then you can work with this for days and weeks if one would like to. But it gives an overview picture. So you would write down key partners, create a list below of buyer, supplier relationship needed to create competitive advantage and reduce risk. That could be one thing. Key activities. List the most important activity directly related to the MVP or the value proposition that you have. List the most important resources needed to create value, or in this case maybe it's customer, but it can also be just development value, what is needed. List the attributes that distinguish your company from its competitors in order to better meet the needs of your customers. It's just things that you need to buy. They could be price. I'm going to be cheaper, which is difficult for a startup, but it could still be the idea that I'm going to be cheaper. You know, there needs to be some unique selling point, otherwise you have no reason to exist as a company. Customer relationship. List the kind of relationship the company wants to have with customer in order to be successful. Channels. List the most effective channels to use in order to distribute your company's value proposition in ways that are fast, efficient, and cost effective. Okay. Customer segment. List the different types of customers that your company needs to target to build a successful business model. And that it's easy in the beginning to say, I'm going to, for example, in my case, the orthopedics, that I'm going to go for all orthopedics. But it's not, that will never work. It's enough, you need to be super sharp. It's going to be, okay, that's not, it's because it's not, no, it's, I think it's because it's not presenting. Yeah. Okay, so, this, I think, maybe will be one of the most important things to learn quickly. Exactly. When you do research, you write these introductions. I normally think that's kind of interesting because the introduction is, I'm going to say the world, and then I've changed the grain size of a ceramic. There's no, you see, when we write our academic introductions, they are super wide, and then in the end, I've changed the grain size. There is such a big leap from what we write and then what we actually do. Here it needs to be super sharp. That's not good enough to be like that. It needs to be sharp. I am going for orthopedics. I'll go for wrist fractures. These fractures, you know, when you fall, especially in Sweden, it's icy. People fall, and there is a breakage of the wrist, and there is a small. You need to fill this. And there is a void when you have the hand straight again. There is a void here. That's the type. They could be the wrist fractures. I'm going to do the wrist fractures. I'm going to do, and this is exactly what I'm going to do. That's the customer segments. Then you can go for exactly these doctors. There's no point to go then to talk to a spine surgeon or someone doing hip joints. I'm going to talk to this surgeon, and I'm going to learn exactly what it is. Okay? Cost structure. List the most important monetary consequences while operating under different models. So this could be, what type of company are you going to be? Are you going to be a tech company? You're going to be sales, distribution, manufacturing? It's easy early on to say, I'm going to develop this product. Because if we can then, as medical device persons, we can hide behind that. But in the end, you need to tell if you're going to be a development company, just developing, and then others are going to sell and distribute, or you're going to be a company that's just developing IP, selling that, or are you going to go to all the way and be a sales and distribution company that you have your own sales and distribution force? That's all viable, but you need to tell. You need to tell early on who you are, what you're thinking. And sometimes it's good to be super sharp and do narrow and say, yeah, we're going to do this, you know, crawl, walk, run. You know, like kids, you need to start to walk and then you run. That type of, some people like that, and others say, you know, I'm going all the way. I'm going to be the next big orthopedic company. And it's up to you in a way. You need to pitch your dream. And on a way, and it's easy to be too small, and then you don't get so much investment because the return on investment is too small. And in other cases, that's exactly the right way to go. So in a way, you need to decide yourself. And then the revenue stream. List the ways in which your company makes money from each customer segment. You remember this one. And then you can say, I'm going to start with the wrist fractures, and then I will move to elbow fracture, you know, when you break the elbow, then I'm going to move to the elbow. Or I'm going to the face. I don't know. You need to list it. I'll go this first and that one. And this area, I intend with peak sales is going to be this much. And with the other one, the peak sales is going to be this much. You can estimate that. And there are ways for, I will go into that when we go through the business plan, writing of the business plan. There are ways today that you can buy information on what I call market intelligence. You can purchase that information. There are companies that sells market intelligence. There are even companies who sells the. You can have them do the Q&A for this one for doctors. You don't need to do that yourself. There's a cost to it, of course, but it's not. It depends on how you look at it. And these are also things I would say, being in academic environment. I don't know India, but I do know Europe and Sweden. These are things that we can apply for soft funding for. Saying I have this research project, I think I will try to start a company on this, but I need to get more information about the market, and I need to do voice of customer, talk to surgeons, talk to companies. Could I get some funding for that? And normally that's doable. It's not mega amounts that I need. There are no salaries. There's a pay for services, and that type of funding we can get. But I don't know if that is available here. Otherwise, I think that's a good suggestion for state funds to start to have that type of funding for researchers, people that would like to start companies that they can apply for, maybe through the tech transfer office or something like that. I think it's a good idea, because you need to fill this in. It's not so easy when you work as a researcher. Suddenly it becomes a lot of business thinking around this, and it's not so easy to start from nothing with that.
Maybe it is covering from TRL 1 to 9 all in one.
Exactly, that's what it is. So you might be a TRL 2 person or a 3. That's where you do your research. Exactly, and suddenly you're supposed to answer questions that how would this look like when you're ready?
Yeah.
And then there are services for this that you can get that information from others. But I assume that one can even have others to even do this type of work for you. But I encourage them, that's okay, but if there is a team, I encourage someone in the team to be highly active. So you don't outsource all of this, because then you just continue the way you continue to work. Okay, so these are 2 templates, and this is just without this filling in. So that's just normally how it could look like before, and then you just start to type. And it's an exercise that one can start with early on. Sit down, do this, and then you know what you don't know, at least. Yeah. And some of these things honestly could be, okay, let's do this now. You and I do it, and then we say 15 minutes. We're going to answer this question. We can just do AI, do some reading. We will do our first go. Then we have something, and we say, we don't think this is good enough, maybe. But you can go very quickly as well, just to have answered the questions first time, and because it could take a lifetime to answer it correctly. So. We'll try this again now. Yeah, now it works better. Good. I will go through how to write the business plan, and then I will show a business plan that I have, since the previous that one is in Swedish, but you will see the extent of it at least, what we have done, and then the one I will show, it's a lot of work behind that, I will tell you, and a lot of consultancy hours done. So with that, I will show that. So this is how to write the business plan, and you will see there are YouTube videos, and there are templates you can download, and there is a lot around this. And there are even those that like 1 hour business plan thing, similar to what I showed with the canvas. You can just start writing something, bullet points, to get something around this. But I encourage everyone within this field, one should have the big dreams, because otherwise maybe it's no point really to go in this field, because I told you yesterday that to go with very small things, you still need investors, and they need to have return of investment. So if you take other people's money to work, you need to be able to give them their money back plus interest. Otherwise, there's no point. And if it's too small, it will take 20 years or 30 years before they get their money back. So it's of course a little bit like that. But I encourage everyone to be super sharp. So again, yesterday evening we had this meeting where we talked about this MVP, and we are still debating in that project exactly where in the clinical indication we're going to use the product. So we're going for spine, but exactly where in the spine and how this is going to work, we are not agreeing within the team. So we are now talking to other experts and talking to regulatory persons, and we're trying to understand this, because it goes into the plan. At the same time, we are writing a new business plan for that company, and we need to be able to describe this, because in the end that gives us the first value, depending on. So if we just say spine is mega, yeah, but we're not going to be in all of the spine. It's not logic. So we need to be sharp. This is exactly the one we're going for, and this is the reason why, and then it leads to a lot of things. So it's easy if one is an engineer, we say I'm developing a new sensor, whatever it is now. Let's say it's a new sensor, then you're supposed to use it everywhere, but it will not be used everywhere. It's going to be used somewhere. Okay, so spend time on that to understand the user. So again, define the idea and the market opportunity. That's the first bullet point, and that's what I'm saying. Go broad, but then also be super sharp, so people will. It also builds a confidence that you know what you're talking about. Otherwise, it feels maybe a little bit too wide, too big. Demonstrate technical and commercial viability. Again, if I would then be, I would have this and an MVP. I have a plan and a minimal viable product. That's a good start. Attract investors, partners, and grants from a business plan. And guide development from research to market. So that's the purpose of the plan. So the first part is an executive summary. Start with that. Summarize the medical device, target problem and the opportunity. Highlight innovation and IP from research. Present vision, business vision and goals. That will be the first, the summary, the people, the first thing they read. I assume that if I would have been an investor and I get 10 of these per day, I just read executive summary, then you're gone, and and then you might go further. So it's very important. They will not read all of it, because the plan will be thick. They will not read all of it for sure.
Executive summary, how many pages we should write?
I will show you. Yeah, actually, I could show you directly. So this is for my company Silox, that is now having all of these contracts here in India. Is it Swedish? Yeah. Strategic business plan 2022 to 2025. Okay, and it's done by Bo Barnström. He's a consultant. Thomas is CEO. He would go to Delhi tomorrow morning. He's here, so he's coming here now because we'll have meetings tomorrow in Delhi. And Hammarstrand, she's a business CFO consultant, and it's a new paradigm within tooth mineralization. Okay, so some background, and then so first is the background, and then comes the summary, and then so these are all the different segments. It's similar to one that I show you now. So it says background, summary, technology, market, strategy, products, and competition, clinic, manufacturing, regulatory, team, finance, investors, and then some extra appendices. And so this is short about Silox. This is just a summary. You can read about the company. It's an innovative technology with unique properties to improve dental mineralization treatments. And then it goes through the history of when it was funded. The first patent by me was in 2008, and it goes through this. And we started the company in 2013, so we had 5 years of research before the company was started. So it goes through all of this and what it is, very briefly. And again, some more bullet points where we are locally in Uppsala, and what we have a manufacturing unit, we have a license agreement with an American company, and that we have a lot of patents. And some milestones, what we have achieved since start. And then it comes to the summary. So that's 1, 2, 3, 4, that's it. That's all. So we go through, in the summary, we go through, we are thinking that we're able to establish a new way of treating sensitive teeth and to remineralize teeth. And then some about the mechanism of action, and that we have a good documentation, and where we are focusing to markets that has about this 40 billion in global. So we give this is the market size that we're focusing on, and like a little bit how the distribution is going, how people are selling. And so most of the value in this case goes through distribution through retail, and only 4% goes for direct sales to dentists. So go through a little bit how the distribution is going, and this our strategy, how we go. What this is our strategy, and we highlight exactly our strategy so they can read that, and where we are focusing. Initially was US, Europe, and Japan, and then what type of products we're going to develop, and that we have sales and how much we sell, and then some of our future looking, and then the much money we think we're going to make in 2010-2025, and how this is distributed, and that we said we're going for a stock exchange. We're going to get listed as soon as we get to a certain level. It says we're going to get listed. So that's it, and then we go through. You see these, what the technology, positioning, and just continues, it never ends. It's, I think it's around 100 pages like this, roughly. Yeah, around this, it just continues.
Executive summary as such is 4 pages.
Yes,
Okay,
that's it. So you read the 4 pages, and then you should.
Maybe.
Very brief.
Should I ask now?
Sure. Yeah.
See, the executive summary generally when we prepare, we generally used to give it to the people those who are the decision makers, whether we should go ahead or not.
Yeah.
So most of them wish to read it maybe during their flight and all that.
Yes.
So we wish to see that it should be as small but content-wise covering to see that the decision makers can take the decision whether to go ahead or not. I think that's why I asked.
How that's exactly the purpose of it.
Yeah.
In this case, it would be if you're looking for money, or if you're looking for investor, or even for yourself. There are 4. So I would say 2 to 4. 2 is a little, but 4 is enough. If it's more than that, more than 4. This is just 4 PowerPoint pages. That's it. Because that you can easily read, and then you would know I like this area, I don't like the area, and if I like the area, do I like this company?
Yeah.
Do I even like this? And then
I would like to tell you, yesterday I had shown you our plan of organ growth in lab for 2047 India now.
Yes.
It requires a huge amount of money to reach to the goal.
Yeah.
And when amount is very large, then we'll have to approach to the politicians or in the. So they are the people who are only looking at what is the value and whether it is relevant with whatever the goal is. So in that case, we try to prepare the executive summary as small as possible, but at the same time, content should be also immediately appeal to the politicians like that.
Sure.
So I think that's a very tough exercise, frankly speaking.
It is.
I've done it, I will share with you.
No, that's super tough. It is, because if you need to think about everything that it says, you cannot leave anything.
Yeah.
So it takes a long time, and I'm starting to have a lot of respect for this type of presentations and summaries. People spend a lot of time on these 4 pages. a lot of thinking. And I think if we would go ahead with this plan now, as you saw, we need to do a new one because this is ending now. So we will update this. So we'll update this plan again because we have changed a lot from this 5 years. But I agree with you that there is a lot to be said. To do this. So today, so I have my son here as well, and he's then working also with investments for his sports tech company, and there he needs to do this one pager. It's the same thing. So the investors tells him, send me a one pager. Yeah, one page. That's it. So he's sitting with that, how should I summarize all of it? What should be on this page? This is the page I get. I need to summarize everything in one page, and it should be readable and it should be attractive for someone to invest in me. At least not say no, because next day they will have someone to read all of this. But the politicians or the managers will not read all of this anyway. They will have someone else read it and say, what does it say in detail? And then they will do their modeling and their Excel sheets and come back. For sure.
I follow one practice, maybe I
Sure.
need your comments on that. Whenever it is to be presented in a one page or the two page, I first start with a lot of pages, like version 1, with coming everything in that. So it may reach to 10 pages, 20 pages, doesn't matter. And then I try to squeeze it to one page. And that version 1, version 2, version 3, that is very problematic. Which part is to be deleted and which part is I think then we need the advice or the comments from you, right?
Yeah, sure. No, I don't do like that.
Yeah.
Now that takes too much time, and it becomes. I know I've learned a long time ago a method. Not now for this one page and so on. Now there are templates. Similar as the business model template. You can take one of those and just fill those in, and you have most of it at one page. You have the one page then. So then it's easier nowadays. But otherwise, I learned this newspaper technique. When you read a newspaper, they always start with the most important thing that is highlighted. And then as you read the article, it gets more and more detailed. It's the same thing you can do here. You start with the most important thing, like a newspaper, that it has been an accident, this is what happened, and this is where. That's enough. Then people know the most important thing first. So you get that, and then you can go more into detail. But with one page nowadays, there are templates. So I'm trying to, in that case, to have a template. Everything should be within that page. But on the other hand, then they've learned that get these questions, please summarize this as one page. We put a lot in that page. But now normally they come back and say, I don't want too much text.
That's good.
Because we can, do smaller font size and we can do cramping. But nowadays they say, no, I would like to have images, graphs, bullet points. Tell me. So but it is an important exercise because when you've done it, it has a great value. Yeah. So you can use it many times then.
Even I guide the students also whenever they prepare their CV. I used to tell them that write down in CV whatever you want, but then squeeze it to one page, and then it should be presented. I find it very tough.
Yeah, it's tough, but I agree with that. If it's too long, me personally, I don't read CVs that are too long. If it's like 10 pages, then I think there's someone there is like did everything they've done, or they have just made up things. It needs to be short. No, I agree. It's the same thing. No, but this just continues to go through the market in quite detail, our strategy, and then our partner we have in the US, how big that is, what's that doing, and in this specific case, just a few years later, this partner was sold twice. So that's things that you don't know is going to happen. They were sold twice, 2 times they were sold, which affected us both positively and negatively at the same time. So these are things that we didn't know at that time. Another strategic judgment, more of that, and then it becomes our products that we are working on, data. These are data from tests that we have done that are independent testing, not only testing by Håkan at Uppsala University, things that we have done at other places or other researchers or dentists have done. Yes. I will not go through this, but it's a lot. And here we then do some mock-up images. Some of them are real, and some are more data-generated images of what we're going to do. We're going to do that and that and that and that. And now when I look back at that. This one we haven't done. This one we still would like to do. So we will have a meeting now about that here in India about fluoride bleach. It's a bleach, peroxide bleach that we would like to do for tooth bleaching. So that we haven't done. This one exists. These two. This one is launched. I think it's going to be launched in India as well soon. I don't have the dates, but I hope so. And these two have been made, and this one has been made only on experimental stage. It's a high fluoride toothpaste, but fluoride has become not so popular anymore. It used to be. I know here it's not popular. I think you have a lot of fluoride in your water already.
Yeah,
In India. Yeah, in India. So you don't. In India, you don't use fluoride toothpaste. In Europe, we do. And now in the US, I think they're also stopping fluoride use for the same reason. So that might not be the case. But that's for people that have a high caries incidence. Anyway, this was the one that we said we were going to do. And as I said, we haven't done all this one, we haven't done, and this one we haven't done. And then financial plan, and then some of our market share that we think, we're looking at very small market shares. But since the market is mega, it still makes sense. Except from tooth mineralization, we think we're going to be big at. And then some clinical data, manufacturing, this is the way we do it. More in detail, the way we have been manufacturing this. Anyway, this is the way it is. I think it's roughly 100 pages, and this is the management and the board. Now we have increased the board with a dentist and a medical doctor from India. So we have now 5 people in the board. And he's the Indian, Sanjay, he's commuting. He comes from Chennai initially, but he lives in Stockholm. Yeah. Anyway, in some of how we're financing, now real numbers, people can have a look at that. And these are the for the investors. If there is an investor, this is the summary for the investor. And you see, this is the similar as I showed you just previously. We fill in this technology. Why are we different? Is there a proof for that? Market potential. This is the industry in general. Technology with many uses, and the patents. And this is what we show them for investors. And the risk analysis, which I showed you yesterday.
Yeah.
We have a risk analysis where we're going through the risks, the risk level, if we need to do something, and then some actions. You remember I said if the risk is high, we need to have either propose something to do or we need to actually do something. So these are exactly risk analysis that similar to what I showed you yesterday. And some pre-money, how much we're valued to. And then these are competitors that we think that we add as an appendix. And then market data. A lot of data points that we had then some way, I don't remember how, acquired to see how the products, the global market, the US market, European market, Asia market, and our penetration, and then calculations about value per year, per product. So you go through this like that, to do all these calculations. Which it was not 100 pages, it was 75. Yeah, so this is a business plan that you in the end, after some work, and so this is what you need roughly. It doesn't need to look exactly like this, but now you have one example that you see.
So I wish to know that you mentioned about the technical feasibility and the economic viability.
Yes.
How technical feasibility is checked?
What are the parameters to check the technical feasibility?
Yeah, that's product by product. Then you need to you need to have a decision.
Are there any standards?
There could be. So there is a mix depending on what type of product that is going to be developed. One needs to check. So I would then do I would check for three things. Either the bench, the technical feasibility could be by standards.
Right.
It needs to have this accuracy.
Standard is not developed.
If the standard is not developed, then you this place or any academic place, we do our own measurements.
Okay.
Then you need to document that and say there is no standard. This is the way we've been measuring. Let's say we're going to measure pH in something difficult. We say there is no standard to measure pH, but we are doing in this way.
Okay.
Then it's up to someone else to judge if this is what we believe is the right value. And then someone else can say critique, you measured wrong. So it's always easier if there is a standard. Actually, funny enough, at my hotel, the Indian Standardization Committee have a meeting today.
Oh.
That's great.
So I said, actually, there is an Indian standardization organization where they will talk about new standards
Yes,
for
yes.
India,
We have.
which is interesting. So there are standards for most things. So one should be aware of those, and then say that's one way of checking. And then it could be in vitro data, which also shows the technical feasibility, either on cells or animals or cadavers. I mean, it could be cadaver animals, it could be surgery technique that you can do on cadavers. You don't need to go into clinic for that. So there are many things, or nowadays within medical device, at least you know about SOBO? SOBO, S-A-W.
What is it about exactly?
SOBO. SOBO.
Sawboard.
Yeah.
It's a sawboard.
Yeah.
Yeah.
You know about that one?
Yeah, we use it.
Yeah, exactly.
Yes.
You can buy. That can also be used to show if you have a screw or a technology. You can show because they have perfect replicas of the body that you can buy everything.
We
And then
use
you
it
can
for showing how exactly the acetabulum is and how exactly joint is.
Exactly. But you can also do like surgery on that.
Yeah.
And you can do mechanical tests. You can do many things.
Yeah.
In that one, they are expensive.
Yeah.
They are not cheap. But actually, even if you go orthopedics, I've been using long time ago. People used wood.
Yeah.
You can buy wood
Yeah.
and show that because it's not so different. So there are standards for pine equals, I don't know what it equals now. Let's say a pine equals hip bone. They can actually do testing in pine and say, no, I don't go for clinic. I use pine. This is the standard. There is papers around this. Pine equals hip bone. So now I do the testing there. So these all are things to show technical viability. If you don't have clinical data, many people ask for clinical data, but it becomes sometimes I feel that becomes a little bit. I mean, it's too much. It's an early company, you're just starting up. There's so many things to do, and then to have clinical data as well, it's complicated. So it's too early. So I understand if you're an investor or someone who is supposed to believe in a company, one would like to see the proof, and the proof is clinical data. But how to get clinical data if I don't have the product? Please let me do my job first, and then you will get the clinical data. I will do the pine wood, and I will do the bone, and I will do the animals, and then I do clinical. So sometimes one needs to be strong as well and say, feasibility, this is feasibility. In medical devices, this is the feasibility. The clinical data comes later. We will not do that first, because it could also damage a project. To do clinic too early, let's say it's successful, but there's still no product. So we can talk forever about this, the technical feasibility part, but it's a way to define it yourself, and then you stand for it. Say this is technical feasibility. Yeah.
Maybe what I particularly feel that if you have a competitor in the market for your product, hopefully it is easier. But if it is a new product, innovative product, I think we'll have to go through a lot of phases. And
Yeah, sure.
and that's where exactly we are focusing on.
Yeah.
Some innovation, some new product which is not existing.
No.
So.
I get that. So it's that makes it more complicated.